Premed Office Hours, episode 194. We are a couple weeks away from episode 200. Amazing. So fun. Thank you, everyone, for joining us today as we go live here on premed.tv and on our Facebook channels and our Facebook group. My name is Dr. Ryan Gray, the founder at Medical School Headquarters. I've written some books. I author some I've written some books. I've authored some podcasts. I host some podcasts. And most importantly, I am colleagues with these amazing people. We have Dina Golini, former senior admissions officer at Stanford School of Medicine. How you doing, Dina?
Good. Happy to be here today. Love Premed Office Hours. Tons of
Getting
fun.
in the thick of application season.
Oh yeah, it's getting busy. Yes,
Things are getting crazy. We've been telling people for a while. We need to get people really focused on writing their essays and doing all that stuff. And
it's almost May.
It's almost May, and now they're finally like, okay, now it's time. Yeah, I should have done that 2 months ago. But that's okay. Yeah. We are here. My sound sounds different. Let me just double check that I have the right audio on. Yeah, that's why. Here you go. I bet this probably sounds a little bit better. How does that sound? Does that sound better? Dr. Scott, right?
No, it sounds the same.
Oh, that's hold on. Settings. Audio. How about now?
Yes. Woohoo!
Yay!
Thank you for letting me know. Just stuck on the wrong setting. But now we are back and better than ever. Just in time to introduce Dr. Scott Wright, Director of Admissions at Western, retired Executive Director at TMDSAS. How you doing, Scott?
Doing very well. I'm excited to be here today. It's always a fun time, and it's fun to answer the questions from all the students, and I enjoy it so much being with my colleagues, and so happy to be here.
Happy to have you, Mr. O, already with some praise here. I pre-matched to my dream school by using your strategies. So thank you all for your help. 2 application cycles later, I get to live my dream.
Awesome.
Some call it a dream, some call it a nightmare. But hey, you're going to be in med school. It's going to be fun. That's awesome. Congrats. All right, let's get rocking. For those who don't know, what we do here is we answer your questions. Again, Dr. Scott Wright, Dina Golini, are admissions experts who are we are lucky enough at Medical School HQ to have them on our team, helping students with their applications, with general pre-med advising, with essay editing, all of that good stuff. And they graciously spend an hour of their time helping you here for free today. So use it, ask your questions, and if you would like some help with your applications, don't forget that you can use the promo code PMOH to save some money on your advising with us at medicalschoolhq.net. So with that said, let's jump into some questions. Triumphant Cat. If I need to reapply, after getting 8 interview invites and 7 waitlists. Some tingly spidey sense comes up going, I wonder what happened. How much do I need to change the writing of my work and activities, personal statement, and secondaries? I was thinking of only tweaking my secondaries to the schools without an interview invite. Dina, I'll start with you on this one. When it comes to reapplicants, this is probably the most common question that we get is how much do I need to change? What do I need to do differently? Yeah. Obviously, there is success in terms of interviews. The schools saw this person's application and said, hey, we like what you have here. But obviously something fell flat with the interviews. We won't get into that. The question's not being asked about that right now, but and they do say interview skills aside. So definitely let's do some mock interviews with us maybe next time.
Yeah.
What do students need to do when the objectively, they were successful with their primary and secondary applications?
I think the key is to make sure that your application as a whole is updated to reflect what you've done since you applied last cycle, right? So if you took on a clinical position working as a medical assistant and you want to highlight that additional direct patient care and clinical exposure, updating that on your application is going to be really important. You're not the same person that you were a year ago when you applied, and that has to be noted in your application. So maybe updating your personal statement to reflect the activities that you completed over this past year, maybe adding in something just to demonstrate your growth, and also adding in any reflections that your perspective has changed on in terms of the way you write up your secondaries. Our school, do schools have access to your previous application if you're applying to the same school? Yes, they do. Do a majority have time to like screen by screen compare? No, but every school is different and you just don't know. So just going through with like a fine eye and really like elevating language, updating, any sort of reflection and updating what you've done in the past year.
Love it. Yeah, it'll be interesting to see the platforms, the systems that schools use. They're typically developed by a third party company, and the schools buy access to be able to
Yeah.
use it to evaluate students and collect all the data from the application services. It'd be interesting to see with the kind of explosion of AI and other tools out there, if the tools that the schools are using to evaluate applications, if
Mm,
there's an easy way for that tool to go, yeah, this person is a reapplicant and their application is 98% the same or 95% the same. It'd be
interesting.
interesting to see if that in the future is a thing, and if it
Yeah.
would help. I don't know. Very interesting. Good question, Triumphant Cat. Definitely. This story reminds me of a student that I did mock interviews with many years ago now. Natalie, she applied to medical school 3 times, and it wasn't until her 3rd application cycle that she found me and like found it was either my book or podcast or whatever. Her first application cycle didn't go well. She wasn't prepared. She needed some post-bac work. So wasn't successful at all first application cycle. Second application cycle, super successful, had I think 6 or 7 interviews, but was rejected from every school. Third application cycle, she finally found me. We did some interview prep, and her first interview with me, I was like, okay, I know why you didn't do
Now
well.
I know.
It was just a train wreck. And so we just kind of pivoted her perspective of what an interview was and what it's there for and what her goals are. And she ended up, again, super successful in terms of interview invites, 6 or 7 of them, but ended up with 6 acceptances third time around. Just changing the focus of her interview, just the idea that she had in her mind of what the interview was supposed to be all about. So interview prep for the win. Come check us out. That's what we're good at. Peyton, very common question. Dr. Scott writes, crisis text line. During COVID, this was one thing that a lot of students were able to do as kind of like the only thing they were able to do. It's interesting, right? Because I have my thoughts. I'd love to hear your thoughts on
My
whether or not a
thoughts too.
student should mark this as clinical.
Well, that's a good question, and I think that I'm going to say 2 things about it. The first thing I'm going to say is the student has to make a decision on whether they feel like it's clinical, and they have to have a good reasoning. Because if, for example, it comes up in an interview, I see that you did a crisis text line, that you consider it clinical. Tell me about why you consider that clinical. And if you're like deer in the headlights, or if you don't have a good answer to that and haven't thought through it well enough, then that's going to be a problem. So I think you have to make a decision as an applicant about what you think, why you think it, what your rationale is, and be able to support that with a pretty good logic and a pretty good ability to talk it out. Now, in
Yeah.
terms of me personally, um, I think it's in a gray area. I think that in telemedicine, in virtual medicine, we all experience virtual medicine in during the pandemic.
Mhm.
And in my mind, is it notably different to have a Zoom medicine call or a text medicine call?
Mhm.
Um, it's a nuance there. I think a case can be made for it to be clinical. It is a patient. They are experiencing a crisis that is typically a mental health crisis, and you are dealing with them. So I think a case can be made for it. If that is exclusively all that you've done clinically, I think that could be problematic.
Mhm.
So I think it's a gray area. I think the case can be made for it, but don't count on that to be your top clinical experience or even the only clinical experience you have.
Yeah. Dina, you have thoughts as well. Do they mimic
Yeah, I
Scott's?
mean,
Different?
yes, I mean, I agree with Scott. It's, how if you consider it clinical, explain why. But I do feel as though it was a really popular activity during the pandemic. It was something
Mhm.
I saw on a lot of applications that I read. Crisis text line, crisis text line. It just it can't be your only clinical experience. That's where I would be concerned, especially,
Right.
4 years out from the pandemic in 2020, where it was really, really common and an easy way to gain some experience. But now it can't be your only one.
Yeah.
Right.
I think
Right.
it's a super valuable experience. I would personally list it as clinical experience, but yes, should not be only because the goal of that clinical experience is making sure that you like being around sick people and the hospital's clinical-ish setting. Obviously, clinical doesn't always depend on the setting, but yeah, good question, Peyton. Here's an interesting, I think, relatively quick answer. Peter asks, in the coursework section, there's an X mark, meaning verified with corrections. Does this mean the grade is still calculated into AMCAS? Yes. All those grades in your application get verified. I don't actually know why they AMCAS, when you print your PDF, it has a kind of a legend with one slash, another
Mhm.
slash, or an X, and it's like we verified this without corrections or with corrections, or I don't know why they tell the student that, because they don't really tell you what they corrected or how or why or anything. So, but all those grades get calculated, Peter. Awesome. Michaela, how do you recommend we list hobbies on an application? Should we list multiple hobbies or just one we are really passionate about? Dina, are you a hobby
Wow.
fan? Fly.
I
That fly's
think
still around?
it's been here for like 2 days and I don't
You gotta get
understand.
Mr.
I'm
Miyagi and some
like,
chopsticks.
it's literally every day at my desk, the fly is here. It just, maybe it's applying to med school and it wants help. I don't know.
Yeah.
It's
Maybe
annoying though.
maybe it's Jerry
Maybe.
Seinfeld, like the Bee Movie, and he just wants a friend.
Or my son or something. Um, I think that hobbies offer some insight into you as a human, right? Like the things that you like to do in your free time. And that's important to a med school class. I mean, to med school admissions, right? Because it's how will you contribute socially to our class? You're not just going to be locked in a library studying. And tell us a little bit about your personality. So I think that listing like a one hobby entry is it is appropriate. I think the problem for me comes when there's like five entries, hobby, 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 too many. It's clear that you're just trying to take up, the 15 slots of hobbies. And then to answer the other part of your question that you're really passionate about, yeah, because you need to be able to write about it, right? So if it's something that like you kind of like doing, maybe once a year, that's not really something that you would have enough experience to write about. But if it's something that's a part of your daily routine that helps define who you are, then I would write about it. But again, please, I mean, I've read, I can't even tell you how many like Dungeons and Dragons hobby entries. I've seen, Dungeons and Dragons, chess, video game enthusiasts. Like there's just when you're listing 4 or 5 like that, it's just clear that there's not a lot of substance or activity anywhere else. So just be really selective about how you do it.
Yeah. So kind of a follow-up question to this one, Scott. Kudaki asks a question here. I've been coaching high school basketball for a few summers now, summer years now, and I feel like it has made me a more passionate and leadership-oriented person. Is this appropriate for a most meaningful activity? So most meaningful on AMCAS at least, and TMDSAS allows you to mark 3 most meaningful activities. A lot of students think the most meaningful is supposed to be clinical or research. But this person here, and potentially the last student, Michaela, who has a hobby, can coaching basketball like this be most meaningful on an application?
Absolutely. I mean, I think, what we try to emphasize to the students, be authentic. Now you have to be careful with that. You can't have 3 hobbies as your most meaningful, or but can this for Kudaki, can basketball be a most meaningful experience, coaching basketball? Absolutely it can. And I think it gives insight into what's important to you, and particularly the way you talk about it is going to be important. But if you talk about it in terms of, because I see this as a mentor, almost a mentorship type activity, knowing what coaches do with students, and how that affects the players. And so short answer is yes, and the long answer is yes.
Short answer and long answer both end up at the same result. Definitely.
Right, absolutely.
The way that I like to kind of tell students how to interpret the most meaningful is most meaningful to you as a person, as a human being, not most meaningful to you as a future physician. Just
Right.
maybe a different way to look at it to help students understand at least
Absolutely.
how I like to think about it.
Yeah,
I agree.
I had a student once tell me she went to a talk at a med school, whether it was virtual or in person, I don't remember, and it was the director of admissions or dean of admissions giving a talk and talking about the applications and what they like to see. And the person speaking said, your 3 most meaningful. One should be clinical, one should be research, one should be shadowing. And I was just like, puke, gross, no. And it just kind of goes back to every school is going to be different. Every school is going to have different expectations and desires and wants and all that stuff. And I can't stand when we pigeonhole students into one cookie cutter way of doing things.
Yeah, that's sad.
It is
sad.
It is.
It's very sad.
I don't like it. Michaela, again, back. Do we need clinical volunteering if we had paid clinical? Michaela, this has come up a bunch recently. Let me find that episode. PremedYears.com. Premed Years, Laurel. Where is she? Oh, there it is. 561. So premedyears.com/561 is an interview I did on the Premed Years with Laurel Poole, the director of admissions at University of Central Florida. And she made it clear that their admissions office likes to see clinical volunteering above and beyond any sort of paid clinical that you may have. They think about it differently. They weigh it more heavily, whatever that right way of saying it is. So at least for that one school, Michaela, they want to see it. All right. Yo Sambo. Dina, I'm going to throw this one to you because Stanford,
Thanks.
again, kind of prestigious research heavy institution. A lot of people would kind of pigeonhole Stanford as that. Would I be looked at unfavorably if I have a lot of research experience, but only about 150 clinical volunteer hours?
It
Does an
depends.
application potentially paint a picture of someone who maybe you should go down the PhD route versus the clinical medicine route?
I mean, I think that if you have a lot of research, you have to make the case for like experience with patient care, an experience with patients, and a desire to want to serve patients and treat patients. So, I mean, I think I need more context for this, because are you a junior in college and you have a ton of research experience, and 150 clinical volunteer hours is a lot if you're halfway through
Uh-huh.
college, right? So I
Uh-huh.
think it's the context of, you know, how many years out are you from school, being in school. Yeah, I think I need more information here. But ultimately, at the end of the day, you do have to have some balance. Now, I will say there are a lot of students I've met with over the past few months who are reapplicants, and will be reapplying this cycle. Here's the fly. um, and and when I look at their application and they're like, where, you know, just give me some advice, I see a lot of research, maybe high stats, and I say, where's the clinical? Where have you worked with a patient? Well, I didn't have time because I was doing research so much, and that's something that, you know, you still need. So you need to make sure that experience with you working with patients in a clinical setting is still there, even if research is your, you know, your focus.
Love it. Yeah, it's up to you as the student to make that argument about why you want to be a physician, not just a researcher.
Scientist.
Scientist. One of those weirdos. Just kidding. Awesome. All right, let's keep rocking. It's kind of a hard question to answer. Let's bring it up, though. Gap years come up all the time. What is the best thing to do during a gap year if I have a few hundred clinical hours and a good amount of research, but the research isn't consistent? So, Dr. Scott Wright, this student makes a point to say that the research is inconsistent, but they don't make a point to say the clinical is not consistent. So I'm assuming clinical is consistent. It's not like a few hundred clinical hours from 3 years ago.
Mm-hmm.
Do we have enough information to provide any valuable insight to the student?
No, I don't. I mean, I
Yeah.
think it's really difficult to know. You know, I mean, number one, I don't know that there's ever a best thing to do during a gap year that you can say to all students. It's going to be very specific to each student in terms of their profile and what's going on with them and what they've done and et cetera. So, you know, we get this question a lot, you know, what should I do during my gap year? And to answer that for an individual student is possible, but to make some general statement about what should you do during your gap year, and there's not enough information here, Arya. I'm sorry. It's really tough because this is just not enough to go on, at least in
Yeah.
my opinion. Yeah.
Yeah, no, I agree. Definitely not enough information here. And this is why it's really hard to give that sort of advice. Potentially, this is a good use for MAP to go. Interesting question. Scott, I'm going to throw this one back to you as well. I'm very passionate about safe injection sites and have been volunteering at one recently. Is it acceptable to include something that can be fairly controversial, such as that?
Mm,
So for those who maybe aren't aware what a safe injection site is, these are locations that are kind of designated for people who are using injections for drugs, for illicit drugs, and places where these people are told, hey, come, it's a safe environment here. We're not going to arrest you. And hopefully we can reduce any sort of infectious disease and contamination and
right.
spreading of that kind of stuff.
Right.
Some people don't agree with safe injection sites. It's seen as promoting drug use. Scott, this comes up a lot, whether it's certain political activism or
Yeah. Yeah.
whatever it may be, Planned Parenthood,
Right. Right.
certain things.
Right.
How much should students be concerned about putting potentially divisive information on their application?
Well, I think you have to be thoughtful about it. I think I think it's reasonable to be concerned. I think that you never know what way things might be read and who's reading it and what their opinions are, and how. I think it depends a lot on how you talk about it, and in your application, if you do choose to have that in the application. I think it depends on how you talk about it. I think it depends on where you're applying. But I think that again, authenticity is really important. And if this is something that's been super important to you, you say in your question that you're passionate about safe injection sites. So if this is something you're passionate about, then seemingly you would have to talk about it, even though it may turn some heads in the process. But you've got to know that going into it, and then make a decision. And the safest route, the most conservative route, would be not to include it. The most pushing the envelope route would be included, and let it be whatever it's going to be. You can't control that. So I think it depends on a little bit on your own position. Are you a risk taker, or are you a averse person? And that may dictate, kind of how you go about it. So that's a tough question.
Yeah. Dina, any other thoughts on that?
I agree with Scott. I think it's all in the way that you write it up. If you make sure that you don't write it up in a controversial way, like you're volunteering there, right? So you're helping a population. And medicine, you don't get to choose your patients. You don't get to choose the reasons that they
Mhm.
come in for treatment. You have to be non-judgmental. So I think writing it up in a way that expresses that it taught you lessons, and being non-judgmental and being authentic is really important.
Mhm.
Yeah. Awesome. There you go, Miles.
It's a good question.
Yeah, it
Yeah.
is a good question.
Yeah.
Tough one.
And I think the same thing happens, these kind of moral, ethical questions that come up in an MMI or traditional
Yeah.
interviews.
Yeah.
You can have your point of view. You're supposed to have your point of view.
Yep.
You need to have your point of view, your conclusion. My general stance is, as long as you're empathetic to the other side and not demonizing the other side, whether it's whatever the topic is, you're allowed to disagree with the interviewer, as long as in your words you're not calling the interviewer dumb or stupid or the devil or whatever may come up in how you're discussing that topic. Here's an interesting question from our friend Peter again. I live in Philadelphia and I've made my medical school list, about 17. Unfortunately, some schools are too far for me to visit. I would like to know how to show my interest besides open houses. Dina,
Mm.
open houses really
Yeah.
aren't a thing in medical school.
No. It's very different than looking at schools for undergrad entry, where there are open houses and campus tours and prospective student days. It's just very different, and part of that has to do with safety and confidentiality. It's most med schools do not do tours. We used to get a lot of questions about that when I was at Stanford. Like, we'd like to visit campus. We sign up for a tour, and the answer was usually no, because you need a badge. You need certain, medical documentation to be working in a clinical setting in terms of like vaccinations and things like that. And there's a lot of confidentiality in a medical school. So there usually are not a lot of campus tours or open houses. If it's a school where their medical school is embedded on the campus, like Vanderbilt comes to mind, Georgetown, where the med school is part of the main campus, then I think that then you could visit the main campus and kind of walk around and get a feel for what life is like. But for the most part, most students do not visit medical schools until they're admitted, and they're invited to second look accepted student days in April. So
Yep.
Yeah, I think a lot of schools will do the AAMC virtual fair, or they'll do different med school fairs, or they'll hold a lot of virtual information sessions. So I think that if you want to gain more information, signing up for those would be great, but you don't have to visit. You might be told by
You might be told
Yeah, I mean, it's hard.
security,
It's
get off
hard.
of our campus.
I mean, I remember at Brown, like if you weren't, the med school is not part of the main campus, and even like undergrad students, other students and faculty from the university did not have access to the medical school. And there are reasons for that, right? There's anatomy labs. There's just a lot of stuff going on. So,
yeah. Awesome. So unfortunately the AAMC virtual fair was just last week, so you missed that one, Peter. The osteopathic fair is on Saturday, so mark your calendars for that. If you just Google DO Medical School Fair, you can find a link to that somewhere. So you can go check that out and go show some interest there. Whether or not it helps or not, you'll learn something.
And I would make a comment here. The second part of Peter's, the second sentence is, I would like to know how I show interest, how I show my interest. In other words, what he's wanting to do is show the medical school that I'm interested in your medical school. And so you do that in your application, and especially in the secondary application. And the secondary is where you can address why you're attracted to that school, and then even more so in the interview itself. If you're able to get an interview, that's where you show that you are interested in that school by what you know about it and what you've why you're interested in it, and the narrative that you're talking about, whether it's verbally or in writing. That's the way you show your interest. Just by showing up at a fair or something and going by the table, even that's easy to do, and that it could be helpful potentially at some medical schools, but that's not going to really show your interest. You do that in the application.
Yeah,
good point.
Love it. Deshaun, just wanted to say thank you. The books have been super helpful in drafting my personal statement. You're welcome. If you would like help reviewing your personal statements, go over to medicalschoolhq.net. We actually have a sale on essay review going on right now. Again, that's medicalschoolhq.net for some essay editing discounts. Go check that out. I've found lots of students are like, I read your book, I loved it, I wrote my personal statement based on it, and I read their personal statement. I'm like, what book are you reading? It doesn't look like my advice. Just be careful. Just be careful out there. All right. So, interesting question here, Peyton. Pretty simple. Should training be included in total hours for either clinical or non-clinical experiences? So this comes up all the time for something like EMT or a medical assistant, where you need a course or certification for it. I typically don't recommend adding those hours in. Dina, do you have a thought on that? Just a quick thought.
I mean, I think only if the certification process had like a clinical component, where like an intense clinical component to it, where you're gaining exposure. I mean, but if you're just sitting and taking tests and doing trainings, then I usually say try to stay away from that.
Yeah. Awesome. Yeah. The problem often comes up where students only have the training that they're putting on their application.
Because they haven't started it.
It comes up a lot. Either they haven't started it, or they never really intended to use it. They just wanted to do the training to gather certifications. And they're like, look, I have clinical experience. I'm like, no, you went through some training. It's more important what you do with that certification than just having the certification.
Yep.
Awesome. Here's a fun question, kind of similar to the earlier one about most meaningful. I moved to Spain to study abroad in a small town to learn Spanish and travel to 12 countries while there. can I use this as a most meaningful experience because it was super impactful to me? So this one comes up all the time because this is a little bit kind of above and beyond the normal. Can I include this kind of non-traditional-ish activity as a most meaningful? And again, a lot of students are just thinking clinical experience, shadowing, research as most meaningful. But the kind of cherry on top for this question is it's study abroad. And we typically call the activity section the extracurricular activity section. And study abroad, Dina, to me is the definition of curricular. So how can this student potentially still utilize this activity and maybe put it as study abroad, but maybe a different way to avoid that thought?
Yeah. I mean, I think traveling to 12 countries, you probably enhanced your cultural competence and just exposure to different populations. And I would think language, right? So you probably do have a lot to reflect on and write about. So I think it's understandable to want to include this. If you did anything in particular during the study abroad, like volunteer work or just working with a certain population, then maybe you could use that and write it up. I don't think putting the actual study abroad as an activity is a good idea, but maybe you could put it as like, I don't know, like a hobby. It's not a hobby. This
Maybe
is
hobby, just travel hobby.
travel. You could put travel
Yeah.
as a hobby. Yeah.
Yeah.
Yeah. Unless you listed it with no hours, because technically if you got credit for the study abroad, right? But
Yeah.
I don't know. This is a perplexing one for me.
Yeah. That's typically my go-to recommendation for something like this, especially all the travel included, because I'm assuming all the travel was not part of the curriculum
Not
and
part of
just
it.
free time on top of it. So I would probably just recommend, if it works, Christian, just to say either travel as a hobby or travel as other, and yeah, just talk about traveling around and how that impacted you.
You also could utilize this in your secondaries. If you get a prompt that says, like talk about a time that you were exposed, you were pushed outside your comfort zone or something, right? You could talk about this trip and what you learned and what you gained out of, visiting so many countries. So there might be another spot for you to discuss it.
Definitely. I love this question. Oh no, I just lost it. Where'd it go? I unstarted. There it is. Can two excellent LORs from doctors and an excellent non-science LOR make up for two, quote, okay science LORs? Dr. Scott writes, this is not for us to determine, right? The medical schools want what they want.
Correct.
Expand on that.
I mean, well, so number one, I'm wondering, I don't know how to pronounce your name, Javraj. I'm wondering how you know this information. So, ostensibly, most letters of recommendation are you're not privy to the content of the letters. Now, I get it. That sometimes doctors, especially, will say, "Well, you write it up, and I'll sign it," or you give me points to cover, and I'll craft it, or whatever. But professors typically don't do that. They're used to writing letters on their own, and so I guess I'm wondering how you're covering 5 different letters here in your question. How do you know what the content of those 5 letters are? And so I guess I agree with you, Ryan. I mean, I think the medical school has to make a judgment about this. I think that letters are an odd thing in general anyway, because a huge majority of letters are okay. They're fine. They're great. Whatever. I think it's if you think about it statistically, it's in the tails where you get a few letters every year in terms of the total number of applicants. You get a few that are just unbelievably fantastic. They just are so effusive, and but that's not the norm. And on the other end, it's also not the norm to get a bad letter. I mean, it
I've
happens
seen some of
kind
those.
of. Yeah, I mean, I've seen some of those, but that's pretty rare. And so the vast majority of letters in that bell curve are just they're fine. They're and I think admissions committees often don't know what to do with letters, because either the person didn't seem to know you very well, or they're kind of just general, or it sounds like boilerplate stuff that they say for everybody the same phrases and stuff. And so my experience is that most letters are fine, and that medical schools don't depend on letters in general to make a huge impact on an application, unless they're just a completely out of the ordinary super duper letter that is really clear that they are just super into you. So
Yeah.
I'd be interested to hear Dina's perspective on this, because she's seen a lot of letters and stuff. And
Yeah,
privy to that.
a lot of bad letters. Yeah, I mean, I interpreted this question to mean maybe you can't get science letters.
Yeah,
And so
that's how
in
I interpret
place,
it too. It's like,
yeah,
yeah,
so in place of the science letters, can I use two excellent doctor letters and a non-science letter? And again, like, Scott said, it depends on what the school wants. If they want two science letters, then you need the two science letters. So I think it's school to school, like, dependent,
yeah,
and you shouldn't be reading the letters ahead of time.
it
But
happens
I mean,
sometimes.
it does happen sometimes. Yes, yes.
Yeah,
But on the admission side, you can pick out letters that are just like, I mean, you just want to, like, take the information that's in those amazing letters and share it
Yeah,
in your
yeah,
evaluation of the applicant.
yeah,
yeah,
But they're few and far between.
yeah,
yeah.
yeah.
I think the biggest thing to remember is that, and I don't have any data on this. I would love if if we could figure that out somehow, but we would need cooperation from med schools and the AAMC and other
Yeah, right.
um, institutions. Is what percentage of students who are not getting interviews, not getting acceptances are because they just kind of
Something like that.
picked and choose the letters that they wanted, and they didn't actually look at the letters that the schools required. Right? Medical schools, when you go to their admissions requirements page, they will typically have a list of letters that they require. And the generic we always say is 2 science and 1 non-science. A lot of schools require a physician letter. Some other schools want X, Y, or Z. And yeah, there are a lot of schools that are like, just give us 3 letters. We don't really care what they are. But I have a feeling that there is some percentage, probably not that insignificant, of students who may be similar to the way that I'm interpreting this question of, like, I'm just going to pick the letters that I want, and they aren't actually looking at what's required to submit. And then they go through the application cycle going, I don't know what happened. I had good grades. I had good activities. And it's one of those things that's really hard to pinpoint. Oh, these 5 schools that you applied to, you're missing a required letter for them. That's why they never reached out to you. And the schools aren't going to sit there going, hey, fine, sir, we noticed you're missing a letter of recommendation, right? They're not going to babysit the students through this
Right.
process. You either do it or you don't do it. They're not going to let you know one way or another.
And some schools might not pick up on the letter requirement, like you meeting the letter requirement, until they actually, like, open up your application. I had a student a few weeks ago that got a late cycle interview invite for a DO school, and she submitted what she thought would count as science letters. And they contacted her and said, we're inviting you to complete our secondary. This was 2 weeks ago. Inviting you to complete our secondary. but you're missing a science letter. We need a letter from from like biology. And she was like, it's been a year. Like literally, I submitted my application to you a year ago, and you had all this time. And they said,
Yeah.
well, we don't really look at
Yeah.
what letters you've submitted until we open up your application and decide to send you a secondary. And it just so happened it was a year later. She was lucky that she reached out to a former biology professor who got her the letter. But it just, sometimes, it could take a long time. And by the time they open up your application, it's kind of too late. So
yeah, and it's interesting, right? And obviously, without knowing any of the context or anything, to me, her blaming the school in that situation, I'm like, it's your responsibility. It's not the school's
Right.
responsibility.
Right.
You're
Yeah.
lucky that they didn't open up your application and go, oh, she's missing a
Yeah.
letter.
Right.
Never mind.
Yeah.
Yeah.
So-
I think it was like general language though, science letters, and maybe she
Yeah,
thought
so-
this
so
particular
maybe
class
if-
counted.
Yeah,
And
maybe
but,
it's their
I
fault
mean,
for not being specific enough.
hmm And I
Uh,
think sometimes students think a PI in a research experience can be a science letter, and that's not the same thing.
If they were
No,
never
it's
your
not.
professor as
If
well.
they were,
yeah.
what they want to know is in the classroom.
Yeah.
Yeah.
Love it. Brittany has an interesting question. Love to hear your thoughts, probably from both of you. If an applicant has a spouse and child, is that factored into the admissions decision? As far as I know, there's nothing on the primary application that specifies marital status or spouse status or children's status. So unless the student calls themselves out and says, well, having kids or blah, 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 or maybe an activity in their activity section as like school PTO president or
Yeah.
board member or something,
Right.
you could interpret, probably rightfully so, that this person is a parent. How does this come up in an application, Scott? Or on the admissions decision as well? if at all?
Well, I think it would come up in an application if you talked about it in your personal statement or in an answer to some question. Uh, potentially, I've seen students talk about. I've seen students talk about their seed being when their child was born, and maybe it had complications, and and whatever, and that is what kind of led them down this road. And so I think that's a big, that's potentially a way that it could come up. In terms of admissions decisions, especially the married thing, that's irrelevant. Medical schools don't really evaluate that at all. And if you talk about your husband or your wife or your spouse or partner or whatever in the application, that's not going to be something irrelevant. I think that sometimes I've seen it before where a applicant was a single parent, and a lot. We had an applicant one time where the applicant was the mother to a single parent to three children, and the way that this narrative went was, I'm pretty limited on some of my activities and stuff just because my life is chaotic as I'm a single parent of three kids. And I think that what our admissions committee would do with that is say, we sort of get it. This is a commitment, and so there was a little bit of leeway there for a situation like that. But generally speaking, especially Brittany, in terms of the way you're talking about it, in terms of a spouse and a child, I don't think it would factor into the admissions decision at all.
Yeah. I don't think so either. So go on. Do your thing. Awesome. Got a couple more questions. Again, if you're interested in potentially working with our advisors, with some interview help. Hint, hint, that student that had lots of interviews and no acceptances. If you want some essay help, if you want whatever help you need, go to medicalschools.net. Yeah, go save some money using PMOH as the code. All right, let me go look at the questions. I'm not gonna look at that one. Let's see, any new ones come up? All right, so I want to speak about this one for a minute. Daniel here saying, last cycle, I submitted my application 3 days after the AMCAS submission date, and my app was processed on August 22nd. Is there a way to avoid such a long processing time? Unfortunately, this is the kind of stuff that leads to students thinking if they don't submit the first day, they're late. I had a student yesterday in Application Academy tell me that she applied late, and that was one of the issues why she's reapplying. I was like, well, when did you submit? And she said, I think it's June 17th. I'm like, you were not late. That's not late. She's like, yeah, but it took forever to process. I'm like, you were not late, right? AMCAS has an issue. AMCAS has a huge issue with their processing time. But that doesn't mean that you are late. And I don't know if the processing time, the issue that has always been an issue is compounded now by people thinking they have to apply earlier to avoid the processing time, thereby just changing when the processing time kind of happens. It's all front loaded now instead of a little bit later. But I would love to hear from both of you. People are like, I have to submit the first day. I have to submit the first day. I have to submit the first hour. If I don't, then it's going to take weeks to process. I'm like, med schools aren't getting your application for weeks. Like, they don't understand. Medical schools aren't receiving these applications until the end of June anyway. Now, 3 days after the submission date and not being processed until August 22nd,
Sounds to me there was an issue.
Exactly. To me, this is not a normal thing. There was an issue with the processing. My guess is that there was a delay in receiving a transcript is probably what happened, if not something much more catastrophic. Having a 2-month delay almost is not normal and not expected. 4 to 6 weeks is typically kind of the peak of the season. So Daniel, submit in June, you'll be fine. And yes, there will be a delay, but everyone is stuck in that delay as well. So,
and if this happens again and you find like months are going by, pick up the phone and call, because I've seen students do that, and it was a transcript, issue.
And this is something where AMCAS on their website has a tool on their toolbar. It's not really a tool, but a notification system on their sidebar that says, we are currently processing applications that were marked for submission on X date. And so students can watch that. And actually, we should capture that data and kind of keep it somewhere so we can see over time what that data looks like. Would be good for us to capture as well. But yeah, Daniel, something happened with your application, and you either know that or you don't know that, but something bad happened with your application.
And I just wanted to point out that TMD SAS does not have these same issues. They're very quick with their processing time. Just wanted to ring the bell of TMD SAS.
Well, I'm going to add more context to that, Scott, because there's a lot more context needed. TMD SAS is not verifying applications like AMCAS is. And so,
well, that's a choice. That's a choice that TMD SAS made for specific reasons.
Correct.
And one of the reasons was processing time.
100%.
And so, I'm just pointing out.
And wasted time. So AMCAS, if we just think from an efficiency standpoint, and then we'll wrap up, AMCAS is verifying all, let's say, 60,000 applications that are being submitted. Only 22,000 of those students from AMCAS-ish are getting into school, meaning whatever the remaining 38,000 applications didn't need to be verified.
Wasted
Right?
time.
And so what TMDSAS does is, let's assume that everyone is telling the truth, because I'm sure TMDSAS had the data that showed, hey, yeah, there is a very small percentage of students who are either purposefully lying or just don't know what the heck they're doing when they're entering their grades. So let's skip that part and wait until a school says, hey, we really liked Johnny, we really liked Sally. Now let's just go verify, make sure they were telling the truth, that all their grades were right. To me, that's the smart way to do it. We're not wasting all this time up front, knowing that, yeah, there may be 3, 4, 5 students at the end of the year that a school says we want them, and then TMDSAS comes back and goes, yeah, no, their transcript was way off. And I'm sure it's not even that number. It's maybe 1 or 2 a year, if that. And I would love for the member schools to tell AMCAS, this is what we want. Like, change your system. And that's what it's going to take. So, all right, friends. I love hanging out with you guys. I love talking shop. We should do it more often. I would love,
like every week. We should do it every week.
We should do it every week, like every Wednesday. I don't know.
It's every
1
Wednesday.
p.m. Eastern. Come hang out with us, and we'll talk shop. I've always thought that we should have like more of a topical kind of discussion where it's not student question led and more just like industry news and stuff. But I just don't think there's enough happening in our industry to have a show other than maybe once a quarter, if that. But it'd be fun. So again, if you want to come hang out with Dina or Dr. Scott Wright, go to medicalschoolhq.net. Check out our advising options. I don't do any one-on-one advising anymore, but I do hang out in Application Academy, and we are closing Application Academy tomorrow. So if you're interested in potentially coming and hanging out in a group setting, it's our most affordable, most valuable thing that we do at Medical School HQ. Again, that's Application Academy. We close tomorrow for Application Academy. So go check that out. All right, friends. Have a wonderful day. Thanks for hanging out.
You too.
Dina,
Thank
Scott.
you.
Yeah.
Bye-bye.